Onartuzumab has been something we've talked about over the last few years after we had some initial positive results in a randomized phase 2 study in refractory lung cancer. This is an antibody to the MET receptor, and the phase 2 results were positive for progression-free survival, and there was a signal that even overall survival was improved when you gave this agent in combination with erlotinib in patients who had so-called MET positive or MET high tumors. This was a finding that started to be consistent in some other work with other compounds and other studies, and this ultimately led to a randomized phase 3 trial, a global study that we presented at ASCO. Unfortunately, in the springtime, just before the ASCO meeting, we learned that the phase 3 study with Onartuzumab MET was negative. That is to say, in patients with refractory lung cancer who all had MET high tumors, when you gave erlotinib and Onartuzumab together, there was no advantage in terms of overall survival, progression-free survival, or response rate. So really an unfortunate finding. This trial enrolled globally at around 500 patients. It was an important study for us to conduct after a positive phase 2 signal, but ultimately was a negative finding. This is on the heels of another negative study in MET lung cancer. This is the Tivantinib trial, the so-called Marquis study. Giorgio Scagliotti presented the negative phase 3 results at ESMO a year ago. There was a similar design of taking patients with refractory non-small cell lung cancer and exposing them to erlotinib with or without, in this case, a small molecule inhibitor, Tivantinib. That too was a negative study, unfortunately. So we now have 2 negative phase 3 trials of MET inhibitors in lung cancer, which raises a lot of questions. Is the target appropriate? Was this just a problem of the drugs that were being developed? Were the trials that were designed not designed correctly? Some difficult questions to answer entirely, but what we do know right now is that the signal appears to be strong, that the MET signaling pathway is an important pathway in oncogenesis in a variety of tumors, including lung cancer.